Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. In this episode, I'm joined by registered dietitian Vann Lovett. Vann wears a lot of hats at Columbia Memorial Hospital. She manages 3 departments, including nutrition services, which feeds everyone healthy and delicious food, the diabetes education department, which works with people with diabetes on how to effectively manage their disease, and medical nutrition therapy, which helps people in and out of the hospital to get the nutrition they need to heal from disease or injury and to reach their health goals. Today, we'll dive into an aspect of health that a lot of people struggle with: excess body weight. We'll talk about how much is too much and why, and all about a 1-year program clinically proven to help people lose weight. Join us for episode 5 of Hands on Health. Hi, Vann. Welcome.
Thank you.
So today we're talking about a program at CMH called Intensive Behavioral Therapy for Obesity, or IBT for short. And I know that many people will hear that word obesity or obese and think immediately, that's not me. So this doesn't have anything to do with me. But unfortunately, a lot of us do fall into either overweight or obese categories, and we may not even know it. That's my understanding. So what does a medical professional mean when they use the word obese?
Right. So obese is, we define that really in terms of your height and your weight. So we take your height and your weight, and we have a formula, and we create this number called body mass index. And that helps us to define your weight as normal. Well, it starts underweight, normal, overweight, or obese. And then there's categories of obesity as well that go up as the BMI goes up.
So how do I know if my extra 5 pounds is making me obese?
Well, I'll say for sure to start that you should ask your primary care provider to make an assessment of your overall health and weight. There is also Dr. Google, who you can ask for a body mass index calculator, BMI calculator, and you can put your height and your weight in there, and it will kick out a number and help you to define it.
Okay, so I did a little research on my own before we started talking, and it looks like for the average height of women in the United States, of being around like 5'3.5", that you are kicking over into obese if you're above about 169 pounds. And then for men, it looks like average height is about 5'9", and they go over into obesity at about 203 pounds. That's based on CDC numbers.
Mm-hmm. So we tend to underestimate or overestimate our weight, which is very, very common for people to either feel like they're much thinner than they are or they're much heavier than they are. And in fact, 40% of Americans are indeed obese. The prevalence of obesity, according to CDC, is right around 40%. So it's a lot of us that fall into that category, and even more if you include overweight. And our concept of that has really changed over time as well. If anybody's watched some of the movies where they show the United States gaining more and more and more weight, and all the colors keep changing, and we keep adding on categories. And so that's really kind of shaped the way we see ourselves and the way we see each other.
Mm-hmm. Well, I know for myself, one of the things that I've struggled with is just changing my perception of what a particular number on the scale might mean. So I was an athlete in college, and I was always at the top end of that overweight BMI because I was really athletic and I was really strong, and muscle weighs more than fat. And so I might have worn a size 6 dress, but I was pushing the edge of obesity. So in some ways, I think I've given myself a free pass for years and years, just thinking, BMI doesn't matter for me. And I guess why do I need to start caring? Or at what point does that high weight of muscle not account for a high BMI?
A pound of muscle and a pound of fat weigh the same, but muscle is going to be much, much more dense. So, a lot of times people will start, maybe people who haven't worked out in many years will start working out and they start building lots of muscle, and then the scale's not moving and they're like, what's going on? But when you talk to them and you say, well, how are your clothes fitting? Their clothes are fitting differently, right? Because things are tightening up. So if you have lots and lots of muscle, you may have a high BMI. Well, somebody with a normal BMI may appear very lean, but their body is mostly fat. We're all built very differently. And that's why it's important to talk to your primary care provider about your body and how you feel and whether or not it's working for you. Additionally, being overweight and obese does increase risk of heart disease. Lots of people that are obese have joint problems. That increases the risk of certain types of cancer, and then, of course, diabetes. So,
which right now we keep hearing about because that's one of those factors that makes COVID much more deadly for people.
Right, and so do overweight and obesity.
Yeah.
So, kind of getting to a healthy weight where you feel healthy and strong. That's really why we do intensive behavioral therapy. Just really trying to help people get healthier.
So can you walk us through what being in intensive behavioral therapy means? What is this program?
Here at CMH, we see patients in our medical nutrition therapy department. The registered dietitians meet with patients, and it's over time for a period of a year. And we start by seeing the patients pretty frequently, and then it tapers off over time. So for the first month, we meet with the patient weekly, and then we go to every other week until month 6, and then we go to monthly for the next 6 months. So it's about 22 visits in a year, and the only requirement is that the patient has a BMI over 30 and that by the 6 months, they've lost 6.6 pounds.
Is there a magic number with 6.6? Is there some reason behind that you're aware of?
Well, it began as a Medicare program, and Medicare chose that number.
Okay.
So I think it's probably, maybe I shouldn't speculate, but it's probably based upon most people have health improvements at 5% weight loss.
Okay.
So using a law of averages, that was the number that was chosen.
Do people have good success achieving that 6.6 pound weight loss?
It is extremely rare that we have somebody that doesn't meet that metric. We really work hard with patients to help them to make goals that they can achieve. So it looks different for everybody.
Yeah. Oh, I mean, I imagine that you're dealing with people who are everywhere from, teenagers possibly all the way up into their 80s, 90s.
This is for adults.
Oh, so you have to be 18 and older?
Yes, it is a program for adults. We do see children and adolescents for weight concerns. They meet with our pediatric dietitian.
Okay.
And we can see them almost as frequently. It's just the same idea, but not a particular program.
Okay. So you said 22 visits. That's a big commitment. Do those all happen in person? Can we have a phone call? How does that work?
So we do need to either see the patient in person or virtually. These visits are usually pretty quick. They're maybe 20 minutes.
What's a typical visit like?
If we're seeing a patient in person, we would typically take a weight, and then we would sit down with the patient and talk about what went well and where they want to go from here. So, each visit is different. People have busy lives and things that come up, and some things go well for a month and then they don't go well for a month. So we really try and dive into what we can control and what we can work on. And then the patient takes it from there. It's very collaborative process. We don't say what you can and can't do. We don't give you a diet plan and say what you can and can't eat. It's more about behaviors and changing the behaviors that are contributing to your weight.
So it's food, exercise, what else?
Food and physical activity. Uh-huh.
Okay.
But it's also, there's a huge mental health component to it
Mm-hmm.
as well. Weight can be it's a very psychological thing for most people. So, talking about how we talk to ourselves can be part of it.
Mm.
And how just because you slip up doesn't mean that doesn't define you. It's not, it's not the way you're going to be now because you had part of a donut that somebody offered you. You're not now a donut eater, and that's breakfast every day or something. So that didn't make very much sense.
No, I think it does because, I look at sometimes how easy it is to adopt new bad behaviors, especially when we're under stress. Like COVID, right? You're home more, maybe you're doing movie night more, so you're doing more popcorn, and that popcorn's gotta be buttered or have cheese on it or whatever you do. Um, and it just becomes kind of part of the habit, and now instead of it being a treat, now it's something that you're doing every night or like
Right.
me, morning coffee with maybe a biscotti has become a bad habit recently, so and it's just you start to expect it or crave it and, breaking the
Yeah.
habit. It's like the habit is the problem.
Yeah, that's really, food does become a reward in some ways, and it can also be just a warm hug, right?
Right.
It, we're not doing a lot of hugging these days, so sometimes you need that biscotti to feel like love.
Yeah. Well, I mean, that's why they call it comfort food, right, or soul food.
It's true. It's true.
Yeah. Hmm. Well, is this covered by insurance? You mentioned Medicare, so I'm assuming Medicare covers it.
Right. It began as a Medicare program, which I think says a lot and is maybe important to bring up. Medicare doesn't pay for many visits with a dietitian, and this is one of the programs. This is one of the only ways that we can see people 22 times for Medicare. That's how important it is, and how big of an impact it can be on your health
Mhm.
to have some sustained weight loss. So Medicare covers it, and it is also covered by Care Oregon. And then with the private payers, it just depends. A lot of private payers have like a wellness program, and it would qualify under that. So it's just something you can call and ask your insurance about, or we can help you with that as well.
Okay, so if somebody's interested, can they call the office or should they, call their doctor? How should they start?
I think it's important that they start with their primary care provider. They really need to be assessed and make sure that their primary care provider agrees that this is something that is important for their health. We do need a referral from a provider to be able to start the program, to have it covered by insurance or Medicare.
One thing I wasn't clear on, I understand that you need to have, a BMI over 30. Do you need to be pre-diabetic, or can you not be diabetic to do this?
The only requirement is a BMI over 30.
So, other
So,
issues aside, if you've got a BMI over 30 and your doctor says this would help.
mhm,
Okay.
yes. Yes. We do have other programs for prediabetes, and then we have programs for people with diabetes. But if they have either one of those and they have a BMI over 30, then we can see them for this one. And there's a lot more flexibility with the schedule. We do see people weekly, but it could be at different times of day. So it's not like signing up for a class and I have to do this every Tuesday at 10, for example. Alternatively, if you really like to be methodical and you want to do it every Tuesday at 10, we can probably make that happen on somebody's schedule.
Okay. So it's really flexible. It sounds like not only is scheduling flexible, but what the program looks like for each person is really flexible and dependent on what they want to do and what their life looks like today and where they hope to go in a year.
Yes.
Okay.
Yes, it has been, as I already said, it's been very, very successful for most of the people the vast majority of the people that have signed up for it.
So before we go, what's one piece of advice you'd give somebody who is looking at themselves and saying, oh, it's time to do something. I need to get a handle on my weight. I want to be healthier.
I would say, again, start with your primary care provider. They are the best able to look at the overall picture of your health and give you some guidance. Also, take a moment to take a deep breath and say it's okay. Don't have to beat yourself up over it. The COVID pounds are here for a lot of us. I'm not immune to the COVID pounds for sure. A lot of people are struggling with weight and motivation and stress, and so give yourself a little hug and then say, okay, it's time to deal with this, and make the call and make an appointment with your primary care provider.
That sounds like good advice. Well, thank you for joining me today, and I hope we have you on again to talk about, there's so much around diet and diabetes and weight and all these big things that are so influential in our health. So I hope you will join me again.
Yes, thank you for having me.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.
Food. I'm such an awkward person. I'm sorry.